It's Thursday, November 19, and this is your Barbados Today Evening News Update. So glad you could join us. We get started with news that the Barbados Hotel and Tourism Association is set to meet with representatives from the Barbados Workers Union next Tuesday to hammer out issues said to be affecting hotel workers. The development comes on the heels of growing claims from hotel employees that they're being unfairly treated. Just yesterday, some 60 former workers of the Club Barbados Resort staged protests demanding their severance payment. Chief Executive Officer of the BHTA, Senator Rudy Grant, assured the association is willing to tackle the issues.
We are in a period when there are significant challenges and we have to ensure that we are properly able to deal with all of the critical issues, and those issues that impact businesses, those issues that impact workers are matters that we have to seek to address in a very serious and immediate way. We are going to have a meeting with the Barbados Workers Union next week, Tuesday, and part of that meeting will seek to address the concerns that the BWU has and workers have with respect to not only what is happening at the club, but where in any other tourism enterprise where there is some concern, and for us to get from the BWU what are the critical issues, and to seek then to bring the parties together for us to have a resolution to those matters.
Meanwhile, more than 24 tourism-related businesses have signed up for the Barbados Employment and Sustainable Transformation Program, but they have come up against some challenges. Chairman of the BHTA, Jeffrey Roach, declined to reveal the challenges, but he said that government has been informed about their concerns.
We have collated that information, and what we have done is that we have actually written to government to indicate to them that there are some challenges, and we actually anticipate that government will respond to us and seek to have those problems addressed, because at the end of the day, remember, the best program is intended wherever possible to keep persons gainfully employed. And we as an association and our members certainly want to ensure that those persons who are employed in the tourism industry continue to be employed and actively engaged.
The Fair Trading Commission said today that it has concluded its investigation into the November 18 and 19, 2019 electricity outages and completed its findings report on the factors which contributed to the events. The statement said the findings report contains the FTC's assessment of the circumstances and causes of the outages based on its review of all information submitted to it by the Barbados Light and Power Company Limited and its own investigation and analysis. The Commission, however, said that due to commercially sensitive nature of information contained in the document, the full findings report will not be published. A summary will, however, be made public. The Neonatal Intensive Care Unit of the Queen Elizabeth Hospital today celebrated 30 years of service to Barbados. Currently, between 450 to 600 babies are admitted to the NICU yearly, some from other Caribbean islands, including Anguilla and Montserrat. Pediatrician in the department, Dr. Gillian Birchwood, says the NICU has significantly improved the island's infant mortality rate since 1990 with the introduction of specialized care for premature babies.
Just for you to understand the impact, in 1972 in Barbados, the neonatal mortality rate was 27 babies for every 1,000 live births. And although that rate had begun to improve because of overall advances in universal healthcare in Barbados, even before the NICU opened, it was still at a high rate of nearly 14 per 1,000 live births in 1989, the year before the NICU here opened. The year after it opened, there was an immediate 35% drop in baby deaths, and although we've had our ups and downs, the rate last year was down to 5.6 per 1,000 live births, nearly 2.5 times less than it was when the unit first opened.
Dr. Clyde Cave, who is a consultant pediatrician in the QEH Department of Pediatrics, said the department has grown by leaps and bounds with the introduction of new technologies to support the high level of care for babies that require special treatment.
The way we look after babies now and the babies we look after now are not the same as we had 30 years ago. It was not expected then that very small or sick babies would receive extraordinary care The expectations have changed along with the technology and the skills. So the challenges we face now are much, much more complex than when we first started. There have been many, many nurses who have given of themselves and their time to babies. Lots of parents who have been part of our journey in this. And of course, the babies, many of whom now are 30 years old.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news in Guyana, the Ministry of Health is set to name a team of professionals to prepare storage facilities and put other systems in place for the rolling out of the COVID-19 vaccine. That's according to Health Minister Dr. Frank Anthony, who met with the Global Vaccine Alliance today to discuss the readiness of a vaccine to combat the pandemic.
By next week, we'll announce the members of the team. We have been working on that. We have both people from ministries, from the private sector, from some technical experts who will be working with us. So by next week, you'll hear the team from the task force, basically, that has been set up to look at vaccines. The COVAX meeting, we had a very extensive meeting this morning. With 92 countries from around the world who would be benefiting from COVAX AMC. That is, these 92 countries were identified by COVAX, and the idea is that Gavi would be assisting in raising funding for these countries so that the cost per vaccine would be very minimal.
On the international scene, the Centers for Disease Control and Prevention today urged Americans not to travel during next week's Thanksgiving holiday to mitigate the spread of the coronavirus as cases of the virus spike around the United States. We have this report from Reuters Television.
On a call with reporters, the CDC's Dr. Henry Walk said the country was facing a dire situation ahead of the holiday.
I think right now we're alarmed. With the exponential increase in cases and hospitalizations and death.
The CDC also warned against gathering with anyone who hasn't lived in the same household for at least 14 days. The remarks come as new infections explode across the country and as the U.S. again set a record for the number of patients hospitalized with COVID-19 nationwide. A Reuters tally showed nearly 79,000 people in the U.S. were hospitalized with the virus on Thursday. Over the past 14 days, hospitalizations jumped nearly 50%, straining the nation's healthcare system and forcing states to impose new restrictions.
It was a tough decision yesterday.
New York City abruptly shut in-person learning as the city's 7-day positive test rate averaged 3%. Mayor Bill de Blasio said it was a painful but necessary step.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.